And we do this because you're going to hear from Manira, and then you're going to hear again from Anna, and then from myself, why it's so important to have this information and to get it out to our community members. So Manira, please take it away.
Thank you, Jill, and thank you, Mariah, for organizing us here today. And thank you to all the partners for being here and for everything you do every day to keep New Yorkers safe. I'm just going to start sharing my screen, and Jill, I'm going to ask for confirmation that you can see.
I can see your screen. Yep.
Okay. Awesome. So today we're going to talk a little bit about how we can keep our community safe from extreme heat. First of all, I want to mention all the amazing work our partners across the city are doing to combat extreme heat, particularly as with climate change, our temperatures continue to increase and we have more and more frequent and intense extreme heat events. And most importantly, one of the things that we look as a powerful tool in our attempts to combat extreme heat are our partnerships with you and others, as you are often trusted messengers with long-held relationships in the communities that we serve. You may be hearing a little bit more about the other work we're doing, we, meaning the city, not necessarily just the health department, but really work being led by our partners at the Mayor's Office of Climate and Environmental Justice around tree planting, cool roofs painting, temperature monitoring, and advocating for more protections for people to stay safe in their homes. And later on, we'll talk a little bit about our Be a Buddy program and how we can all be each other's neighbor, brother, sister to keep each other safe when it's a hot event. So this is just a quick overview. We'll be talking about why we worry about heat, who's most at risk for heat, how to know that you are in heat distress, how to stay safe indoors, a little bit about the Home Energy Assistance Program and its wonderful cooling assistance component, which provides air conditioners, as well as power outages, which often occur during extreme heat, and our Be a Buddy program. So just on a bigger scope, why are we even worried about heat? Oftentimes people just see heat as an inconvenience, but actually heat can pose severe health impacts. And on average, of all the extreme weather that happens in New York City and across the country, extreme heat is often the most fatal. And in New York City, we see that the heat alone causes about 350 deaths. During heat waves or extreme heat events, we see that specifically during those times when the temperature is extremely hot, on average, New York City has about 10 heat stroke deaths. Those are hyperthermia deaths, as well as another 100 deaths that are exacerbated by the heat, meaning that although the heat didn't directly kill someone, the heat probably exacerbated or worsened existing health conditions like heart disease, kidney disease, and led to a death that was earlier. That's during the extreme. But if you look at the summer throughout, we see that heat is still very fatal. On those non-extreme but still warm days, and we're considering warm temperatures that are above 82 degrees, but below 95 degrees, we still see that about 250 more people died than was expected. And we use this using statistical analyses where we know during a given temperature and a given day that we only expect to see this many amount of deaths. But we can look and see that when the temperature starts spiking above 82 degrees, we see a lot more deaths. And so that's again showing that the impacts of heat are really all summer long. And unfortunately, those impacts are not equal. In New York City, sadly, Black New Yorkers are twice as likely to die from heat-related illness than our white New Yorkers. And that is really due to the impacts of structural racism that limits the type of opportunities where economic, housing, educational opportunities are very much still biased and segregated. And so we as a city, as our partners, we're working to really dismantle those systems and make this an equitable city. And besides deaths, we also see that there are about 450 emergency room visits for heat illness, as well as an overall increase in the number of hospital visits for lung disease, heart disease, and kidney disease. And sadly, in New York City, when the temperature is hot outside because of the way our housing stock is built, the temperatures indoors can be 10 to 20 degrees hotter. So when you have a 90-degree day indoors in certain apartments and homes, that temperature can go up to 110 degrees. And when we look again at our data around heat deaths, we see that most heat stroke deaths happen in homes where there was no air conditioner and no air conditioners present, or the air conditioner wasn't in use. And sometimes we found cases where even though there was no air conditioner, there were still fans that were in use. So we say that fans by themselves are not enough to stay safe in hot weather.
So excuse me, Manira, Nikki had a question in the
Oh,
chat. So, and it was directly about that slide. And the question is, are the death statistics per day or per month, or for this, I would assume for the season?
they're from the season, for the season, and we consider a season from May to September. But for climate change, we're seeing earlier and earlier and later heat events. But for now, those statistics are from May to September of each year. And we tend to look at 10-year periods. Was there one more question? Okay, you're welcome. Thank you, Nikki, for that. So now that we know where the risk is, we try to figure out who is most at risk. And we find that it is a combination of two things. It's the environmental risk, that's not having or not using an air conditioner, and having another condition. For most people, not having an air conditioner, you'll still be fine during heat events or during the summer. When you have air conditioning, plus you're older, and we consider older 60 and over, and if you have chronic health conditions such as heart, kidney, and lung disease, if you have alcohol or substance use disorders, if you have serious mental health conditions, if there's a cognitive impairment that limits your ability to communicate that you're hot or that you feel hot, and also social or physical isolation. And another risk factor is the use of certain medications. Those medications may also impact how your body reacts to the heat, how you interpret the heat. And so often, one thing you can tell your clients and all those in your network, oftentimes people have several doctors and they're not necessarily coordinating all the medications, but oftentimes people have one pharmacist. So we really encourage people who are using many medications to speak to the pharmacist to see how those medications may impact a person during extreme heat. And so how do you know someone is going through heat distress? Well, for heat stroke, which is the most severe of all heat-related illnesses, one of the key signs to look for is hot, dry skin. Usually, the body's response to heat is to sweat. But when the body has stopped producing sweat and it becomes hot to the touch, that is a sign of immediate distress. If you or someone or you know is going through that, call 911 immediately. Other signs are confusion, hallucinations, unconsciousness, unresponsiveness, nausea, vomiting, trouble breathing, a rapid, strong pulse, or weakness and dizziness. Heat exhaustion is less serious than heat stroke, but could be a forewarning that more severe body responses are happening. So what are the signs for heat exhaustion? Cool, moist skin, heavy sweating, muscle cramps, lightheadedness, headache, decreased energy, loss of appetite, or thirst. When you see those signs, get someone to a cool place. If they can, provide them with water and monitor them. If their symptoms continue to progress into signs of heat stroke, that's when we recommend call 911 or get them immediate medical assistance. And as you probably have heard or surmised by now, the most effective way to prevent heat illness is to use air conditioner. And it doesn't necessarily mean using the air conditioner all summer long or at all hours during a heat wave. Even a few hours of cooling can be a lifesaver. And when you use air conditioning, and if we know that cost is a burden to many households in New York City, especially with the economic distress so many are experiencing, we also recommend that you can use air conditioner, encourage your clients or the people in your network to perhaps use an air conditioner in the room where they spend the bulk of their time. Another great way to both save on electrical bills, to conserve energy and protect our grid, and also to be comfortable, is to set the air conditioner to low cool or about 78 degrees. And I have to say, I do this for a living, and every summer my mother complains about the air conditioner and it being too cold, so she would prefer not to use the air conditioner. And then I see that she's setting the air conditioner to 63, 64 degrees. I'm like, Ma, you're cold, because it's such a really intense setting. And so I remind her that you don't necessarily need to set it at the most coldest setting. So a reminder, 78 degrees or whatever is comfortable without it becoming comfortable, again, can save on the bill, and it can protect our grid, and it could contribute to better comfort. The other recommendation is to hydrate, hydrate, hydrate. The second best way to beat the heat is to drink. There are certain conditions that hydration may interfere with the body's mechanism. So for those conditions, we really recommend that people speak with their providers to have a game plan. And I think, Jill, are there questions popping up?
There is one from Michael Anderson about heat. He gets the heat benefit. They wanted to know if there was a good portable air conditioner to recommend. He's not allowed to install one in the window. And I know that that's probably not a question we can answer, but we have the information slide up about the HEAP program. So we'll go over that.
That's a really great transition. Thank you, Michael. Just as an introduction to what HEAP is a federally funded program that is designed by our partners at New York State Office of Temporary Disability and Assistance, and it is administered here in New York City by our partners at HRA. So the Home Energy Assistance Program provides with the free purchase and installation of air conditioners for a value of up to $800. In order to qualify this program, you need to meet certain income criteria as well as other criteria. For example, you cannot have received a new air conditioner in the last 5 years. In the past, a letter from a healthcare provider documenting the need for an air conditioner was required, but for this year, that letter is not required. And so we're really encouraging people who need this benefit to apply, because we're not sure if this waiver of the documentation will be around next year. We hope it will be, but we know for this year that it is not required. And another thing that we really want to highlight is, in the past, people who have lived in public housing or have received some kind of housing subsidy, such as Section 8, were not allowed to receive this benefit. Starting in 2020, that regulation has changed, so that way people who do live in public housing or receive Section 8 or other housing subsidies can qualify. The application period is open. It's been open since last Monday, and it closes at the end of August or until funds are used, whichever comes first. So we really recommend and encourage that people apply. We don't want to leave any money on the table. And I think, Michael, for your question, portable air conditioners are covered. And I am not sure, but we can check with our partners at HRA. I do believe that you have to go through their vendor list, and the vendor list will help identify where you can get that portable air conditioner. And portable air conditioners are only allowed if there is no space in the window or there's no sleeve for air conditioning. I hope that helped, and we'll follow up again to get you more specific information. Jill, were there any other questions about HEAP before I move on a little bit?
I do not see any more.
All right, great. Thank you. And thank you, Michael, for that question. Right, and unfortunately, when we are during periods of severe heat, that is when we are putting the most strain on our power grid. And so sometimes we run the risk of having power outages. And so when we do have power outages, that has direct impact on health. We lose our AC, and for people who are heat vulnerable, that could be a matter of life and death. We also see increased needs for ambulance and EMS services. Chronic health conditions are exacerbated. And most importantly, for people who rely on life-sustaining equipment that runs on electricity, it could be extremely dangerous. So we recommend that people who rely on such equipment register with a utility provider. That way the utility provider can provide advance notice to the household if a power outage is coming up. And even if a household does not pay for electricity, if it's included in the rent, they can still contact the utility provider to inform the provider that there is someone who relies on electrically powered medical equipment. And we also encourage households that do have someone who relies on that equipment to have a plan that includes having backup equipment and batteries. For someone who relies on oxygen, having backup oxygen tanks that can be safely stored. And as I said, setting the air conditioner to 78 degrees or low cool can help us avert power failures. And my final thought, I believe this is one of our last slides, is we really encourage everyone to be a buddy. We are each other's keepers, especially as we are becoming more and more isolated. And apologies, I didn't update this from last year, but we really do encourage each other to check on our family, friends, and neighbors who are more prone to heat illness. Those check-ins can be over the phone, in person, and depending if it's more comfortable, virtually, just to find out, do they have an air conditioner? Do they have a place to go? Our partners at Emergency Management and other community partners operationalize hundreds of cooling centers across the city that provide valuable breaks from hot weather. And so there is a way, if you cannot stay home safely during a heat event, to find a place that is publicly accessible and comfortable to stay cool. And you can find those cooling centers by calling 311. If people sometimes may feel comfortable going to some place that's more familiar, so you can help people find places or homes or family or friends who may be willing to open their door for a few hours to give their people in their social networks access to cooling centers. And as an organization and as a faith-based community, even before a heat wave, you can identify who within your network is most at risk. And how do you do that? Well, you ask if they have an air conditioner, you try to understand what type of health conditions they have, and whether there are folks or places they can go to when it is hot to stay safe. Other things that we encourage people to do, wear light, loose clothing and watch out for signs and symptoms of heat illness. So just a quick summary of our key health messages. People at highest risk do not have air conditioning, plus they have other risk factors such as chronic health conditions, chronic mental health problems, use of certain medications. Power outages are more likely to occur when it's hot outside, and they can be life-threatening, especially for people who rely on life-sustaining electrically powered medical equipment. Know the signs of heat illness, in particular for heat stroke, is that dry skin. Fans alone aren't enough to stay safe when it's very hot outside. Impacts of extreme heat are all summer long. So encouraging people, even when it's not a heat wave, to use air conditioning, even if for a couple of hours, to give the body a break. Be a buddy, check on friends, know who those friends that need to be checked on before the emergency. when there's an emergency, check on them and encourage them either to use air conditioner, and if they don't have it, to find a place to stay cool. Set your air conditioner to 78 degrees or low cool, and that'll help people and households stay comfortable, save money, and conserve electricity and protect our grid. If a household doesn't have air conditioner, encourage them to look into the Home Energy Assistance Program to see if they qualify for free air conditioning. Encourage them to visit someone with air conditioner. Encourage them to visit a place outside of their home, like a cooling center or other cool spaces. It could be a public space, such as a mall, a Target, but don't let Target know I said that, but other places that are accessible within the community, walkable, that can serve as a place. This is just a link of our online resources. We'll be sharing this presentation so you can go through and find information that you can share with your partners. And that is the end of my presentation. Thank you.
Thank you so much, Manera. Right now, before Anna starts, we want to just check in and see if anybody has any further questions about this. For you observers of our content, you're going to notice that we're going to repeat some things, and these are important issues. So you may hear a little bit more about heat illness or heat exhaustion. We're going to repeat the information and take a deeper dive into the cooling centers with Anna McCullough from the Human Services team, our next presenter. So it's so important to get this information, and every time I hear it, and I've heard it for a number of years now, I take away something a little bit different, something new. And as someone who actually experienced heat exhaustion in 2020, believe you me, I pay attention to this presentation because it really is something that affects so many of us and can happen when we, it can sneak up on you, especially when we have those hot, hazy and humid days. And if we're out wearing our mask, if we're doing any kind of exercise, for people that are working outdoors, they also have some special hazards. The workers, they really have to pay attention to these symptoms, and they get training, from their companies about that. But it's so important for us and to spread the information, which Manera did so beautifully. So Anna, now I'm going to invite you to join. Thank you.
All right. Hello, how are you? Hi, everybody. Great. Can you hear me?
Yes.
Okay, great. Just going to share my screen. One moment, please. All right. And you're able to see the screen?
Yes.
Fantastic. Okay, great. So good afternoon, everybody. My name is Anna McCullough, and I am the Disabilities Access and Functional Needs Human Services Specialist here at New York City Emergency Management. I'm really excited to go over our tips for preparing against extreme heat and more into our cooling centers. So first off, who are we? New York City Emergency Management, or as we say, NYCEM, helps New Yorkers before, during, and after emergencies to prepare, educate, and respond. During heat emergencies, NYCEM aims to fulfill several objectives by activating our heat emergency plan. And a few of these objectives are to provide hazard awareness and disseminate public messaging, and as well as minimizing impacts to public health. So today we're going to dive into a few of these operational strategies that we use to complete these objectives. So the first is going to be staying informed. Disseminating public information is a vital step in our efforts to prepare New Yorkers against extreme heat. And just as Joe was saying, getting the message across is important and can save lives. And we have many means of delivering messaging to the public, such as press releases, conferences, our advanced warning system alerts, social media, our Notify NYC alerts, outreach to elected officials, and then messaging to community engagement partners. So just to dive into a few of these, Notify NYC is a free communications tool that delivers alerts via many different formats, including email and text. And these are directed more towards individuals. And it comes in many different languages. And right now we have over 1 million subscribers. And this is a great way to decide what types of tips and alerts you'd like to receive personally. And you can tailor them to what you need. Our next alert system is called the Advanced Warning System, or as we say, AWS. And this communication tool is used to disseminate information to agencies and non-governmental organizations that serve people with disabilities or access and functional needs. During heat emergency, we time these alerts with press releases and important information that announce heat advisories, warnings, and provide essential information and tips regarding the emergency. So we send these out to our subscribers, and then those organizations can then tailor the messages specifically for their clients and amplify our message so that everybody can be warned and as well take the measures that they need to prepare themselves. We also ensure that messaging is deployed through the agency's social media channels. These types of public messaging ensure that residents are aware of potential heat impacts and then provide tips. We also recommend other social media channels not affiliated with NYCEMS, such as Nextdoor. This can be a useful tool that provides information about neighborhoods directly from the residents themselves. So many ways to get information, and we like to just make sure that everybody knows all of these different ways. And at the end, there are links so you can figure out how to sign up for any of these. All right. And so another strategy that we employ during heat emergencies is the Cooling Center program. So we heard a little bit about this, but the Cooling Center program was developed to provide New Yorkers with the opportunity to visit a safe, free, and air-conditioned facility during heat emergencies. So we open these across the 5 boroughs when there is a heat emergency, and cooling centers are open and free to the public, and anybody is allowed to visit. While everybody can be vulnerable to extreme heat, some of the most at-risk individuals may include, but not limited to, people 60 years and older, people with disabilities or access and functional needs, those with chronic health conditions or who might be taking certain medications, and people without air conditioning or those who can't afford to pay for their air conditioning. So the question is, how do we ensure that those who might be at most risk actually visit our cooling centers? And one of the ways that we try to make sure people want to is to open cooling centers in natural meeting sites, such as older adult centers, libraries, recreation centers, places that visitors can engage in additional activities and additional programming while also being able to cool off. Our 7 traditional partners include the Department for Aging, the Department of Parks and Rec, Department for Youth and Community Development, Salvation Army, and then our 3 public libraries of New York, Queens, and Brooklyn. And we also occasionally coordinate with other NGOs or private companies to increase cooling center availability, especially in vulnerable neighborhoods. And we really try to bolster the cooling center availability in neighborhoods that have been identified as located in a high heat vulnerability index area. And so when we're planning in our pre-seasons, we look and plan to prepare by looking at the map of the most vulnerable neighborhoods and making sure that we have coverage everywhere, but especially where people might be most at risk. We just want to make sure that the centers are opened and often visited so people want to visit and not just sitting there twiddling their thumbs, but we can gain things and be in a trusted environment in their community. And just here to the right is the cooling center sign that you will see hung up outside of our facilities. And when these are up, that means cooling centers are open. All right. And so the 2022 heat season. So question might be, which cooling centers are going to be available? What are they? Where are they? In New York City this year, we're going to have over 500 of facilities available in our system. that are going to open across all 5 boroughs. However, during each heat activation, we just want everybody to know that the open centers may vary by activation day. So it's really important that you do get the most up-to-date information. And one way to do that is through our website called the Cooling Center Finder. And this is a publicly available website that is open and activated only during activations, and it presents the most up-to-date information. The picture below here is from last year, and this is what the Cooling Center Finder will look like once it is activated. Individuals can find out more details such as facility accessibility, operating hours, whether or not the facility is pet friendly, which we do have, and many Petcos around the city. So great if you do have a pet and you want to stay cool, we have options for you. And then, as Munira also mentioned, New Yorkers can also call 311 to get the most up-to-date cooling center information. So definitely want to push that if you are looking for one, please, please, please check online or call before you go to one, as hours and openings may vary based on activation day. And then this year, so what are our COVID-19 protocols? We're excited to have more cooling centers open than we have in the past 2 years due to the pandemic. However, we are still keeping a close eye on COVID-19 and the safety of our cooling center staff and visitors. Currently, cooling centers are going to be maintaining their own agency's pandemic protocols. However, NYCM has been assisting with procuring any necessary PPE or signage and anything that they may need to make their staff and visitors feel more comfortable. So any visitors will just have to follow that facility's own protocols. We are keeping a close eye on DOHMH's guidance and any other city requirements in case things change throughout the summer. So if updates are made, that will be shown throughout each of the facilities.
Hey, Anna, there was
Sure.
a question in the
Oh,
chat
absolutely.
from Laura. East Flatbush and neighborhoods to its east are heat islands, but in the past have had few or no cooling centers. Will that be addressed this summer? And she also gave a shout out for pets and some messaging for pets, encouraging people not to walk their pets on hot sunny days. Especially in areas where the pets have to walk on asphalt, concrete, or slate, such as above Brooklyn Borough Hall. That one is probably a comment for comms. So Laura, I'll be in charge of getting that to our communications team. But Anna, can you address the East Flatbush? And that's a neighborhood in Brooklyn for those of you who are joining us from outside of Brooklyn. Could you please address that?
Sure. So I will have to look specifically into the East Flatbush neighborhood to see what is available this year. I'm not sure if it was closures due to COVID-19 or if there just weren't available facilities in years prior to that. Can definitely look into that and see. We do want to bolster any communities that don't have enough centers. That's always our goal. But I can get more information for you on that. And that kind of leads into my next slide, which is trying to get more centers and trying to get places that are trusted in the community to ensure that everybody has a spot in their own neighborhood. But yep, sorry, I will definitely find out more information on that neighborhood specifically. And then the messaging on pets. Sorry, I lost the chat again. Yeah, I think that is a great idea about messaging more about pets and walking. I think it's something that might not be thought about as frequently as needed. So we can definitely think about adding that to our messaging this year for sure. All right, and so as I mentioned, supporting our community. So we're always looking for new spaces. We have these traditional facilities, but we also have our nonprofits and other private companies who have offered to become cooling centers. And we don't have that many requirements. So if you do have a place or facility in mind, then we would love to hear about it. We have a survey on our website called Share Your Space, and there you can just input information about capacity, where it's located, do you have AC? Our requirements are just that the cooling center must be free and open to the public. It must have air conditioning and must be able to provide drinking water to any visitors. And that can either be a water fountain or a bottle of water. We also prefer to have cups if possible for people with disabilities if it's just a water fountain. And then also must be open during daytime hours since our heat hours are really important during midday. Also another note, we do have extended hours for some of our facilities each summer. And that's when we're in really, really long hot days. So that is something that you can also find on our cooling center finder. That detail is available and it will show if extended hours are offered at the location nearest you.
Anna, we do have
Another
another,
question?
yes, we do.
Sure.
Jen. From Margaret Brewer, Brownsville was another with few cooling locations. Getting ACs were somewhat challenging. Can we expect more support on this side of the pandemic? So I know that Manira covered the air conditioning issue, cooling assistance benefit covered by HEAP. So we would need to refer you to the HRA to access HRA. We'll be sending those links out after the presentation. There was a program in 2020 from the city, not from New York State's OTDA, with that federal money that is an ongoing program to provide home energy assistance. That program is over, but the program that's still ongoing is the HEAP program, but it only allows for people to get the actual unit and to get it installed, right? So I know it's very frustrating when you live in a hot area, but there is some help and there are these great suggestions. The one other question that I had about the Share Your Space for Anna is my understanding too was that the cooling centers need to be fully accessible to people that are using mobility devices, i.e. it can't be in the basement somewhere with no elevator, right? You have to be able to enter the establishment.
Definitely prefer to have an accessible facility. Want to make sure that everybody can visit. We do have some in our program that aren't, but they were kind of built into this program from previous years. So if that's what you see on our cooling center finder, that some may not be marked as accessible, that is why they were kind of grandfathered in. But yes, we do prefer an accessible location to make sure that everybody has access to it.
Thank you for that clarification. That's good to know. So Manira asked a question for Margaret, and Margaret, she was really interested to hear if you could be more specific about the challenges of getting ACs, or if you know of certain community members that may have gotten booted off before. I think what's really important to underscore is what Manira pointed out in her presentation about that there is no longer medical documentation. That documentation that HEAP specifically required is not required this year. So Margaret writes to us that there were limited units. Margaret, are you referring to 2020? Or are you referring to the city's program in 2020 that was special for the pandemic? Or are you talking about HEAP in general over, let's say the last 5 or 10 years? But that is a good point, Margaret, because what HEAP tells us in there when they promote the program is that until they run out of funds, they do specify that. Okay, Margaret writes, not sure if it was via the Department of the Aging. Okay, so we'll take this up and we're going to connect Manira to you. And Laura brings up another issue about the cooling centers. They're far apart. Seniors who are not near one would have to travel 10 to 20 blocks. And can NYCM assist with tents and chairs that people can stand or sit under in areas with few trees examples at the bus stops, at food pantries with long lines, other places where people congregate to get away from the sun. I'm not sure, Anna, if you, I'm not qualified to answer that question, that's for sure, but I can take it down and note it.
Yeah, I'll definitely note this as well right now. For the summer, I don't believe that we'll have the ability to do that with tents or chairs, especially given that we do have over 500 locations. It would kind of be difficult to pinpoint exactly where that would be needed and how to get it to those specific locations every time. But that's something we can look into. And I know transportation is always a question too. This year, we don't have that set up for constant transportation, but if a situation arises, we will notify the public if there are more options available.
Okay, we do have, this is a great conversation, obviously, because we're getting a lot of questions in the chat. Is there a link we can provide for our seniors for HEAP? That's from Raymond Serrano. Yes, and you can also always refer people to 311. And again, we're going to send out all the information afterwards, and I'll have a link to what we're sending out in next week's community preparedness newsletter. So if you've registered for the session, you'll get it, and it will also be in the newsletter. And we're going to connect Margaret to Manira. Christine writes, tried to get an air conditioner last year, told that Christine wasn't eligible. Christine, 65, on Section 8, lives in a night shift building in Williamsburg. No outlet by the window to install an air conditioner. And Manira, I know you're not a HEAP expert, but do you have, is it possible that Christine might be eligible this year? But I do believe the outlet not by the window is an issue.
Yeah. The other thing, of course, is that unfortunately, if air conditioners aren't installed properly, they could pose a tripping hazard, a fire hazard, or a fall hazard. So I would defer this question to HRA, and maybe Christine, we can get in contact with you and get more information, and we can connect with HRA to figure out exactly why.
I also wanted to point out, sorry, apologies if you already did. I know that if an AC can't be installed safely, you can also get a fan, which isn't necessarily the same thing, but another option, if that's something.
And it actually just reminded me, you could also get a portable air conditioner, so that way the air conditioner can go towards the outlet. So you'll have Anna, Jill, Mariah, and I on the case, and we'll get to you.
Yeah, I'm pretty sure there's specific instructions about how you plug in a portable air conditioner. I'm pretty sure it's going to have to go into a wall socket and not into a multi-outlet strip, similar to what we do with heat devices. I mean, again, I'm not the expert on this, but I have to assume that the safety is really paramount. And Evelyn Vieira, thank you for clarifying that you're logged on as Raymond Serrano. We appreciate that. So again,
Jill,
yes.
One more thing, with the portables, it also requires frequent drainage and piping that leads to the outside. So for people who have limited mobility, it may not be able to bend down and clear it, and also how to set up the actual venting to the outside. It'd also be an issue. So, Christine, we can find out more, and as Anna mentioned, although not ideal, fans are still possible.
Yeah. And Michael, again, are you limited to one AC per unit per apartment? Yes, that is when you're getting it from HEAP, it is one AC. And that's why, as Manira stated, putting it in a room that you use the most is the best idea. And I know, because we have so many faith partners on, happy about that. Anna's putting the share your space. If you think that your space would be a great space and you want to share it with the greater community, you can click that link. We'll send that on to you, and someone will come out and give your space a look-see. And we really thank you for joining us. Rachel, oh my God, look at that. Okay, so just very exciting,
then
Anna. Rachel
one
Forrest
more.
already completed the Share Your Space.
Oh my
already.
goodness, great.
That's a win. Thank you.
Looking forward to looking into that, Rachel. Thank you. And yes, just a few more resources here as well. We have our Beat the Heat website, and this provides lots of different resources. This is where you can find the Cooling Center Finder, and as well as, yeah, just more heat tips. And then it can also bring you to links. At the bottom, you'll see the NYC Parks Cool It program, which shows you where cool water features around the city are located, and then more about the heat program and more about Department of Health facts. And then also our links for registering for emergency alerts for the Notify NYC, which is more for individuals, and then for the Advanced Warning System, which is for organizations that serve people with disabilities or access and functional needs. All right, and that's all I have, but if any more questions, please feel free to ask.
Thanks, Anna. That was a plethora of information, and it's very,
I know.
it's so exciting to have a full complement of cooling centers on again. So
yes, we're so excited.
We want our partners to share that information. When you hear that there's a heat activation or a heat event, you hear it on the news, or you get it in the community preparedness newsletter, shameless plug, or through Notify NYC, please share that with your congregations, community members, etc. So important. And now it is my turn. Oh, Rachel Forrest again. They helped a couple of members apply, but they got denied because of the letter required. They will help them resubmit this year. This is the win, and this is why we do this webinar, to get the information out to you about the changes that are happening. And the last few years have shown us that, you know, situations change from year to year. As Anna said, the cooling center sites may change from heat activation to heat activation. So we want you to really check that. The easy way to do it without Wi-Fi or computer is to call 311. And now I'm going to go ahead and share my screen because I get to do the slides from the Mayor's Office of Climate and Environmental Justice. Can everybody see my slides?
Hi, Jill, we can see them. If you could do the display settings and just.
Yeah, it just keeps wanting to do that. Okay. So this is from the Mayor's Office of Climate and Environmental Justice. These are city programs for taking care of New Yorkers and protecting them from extreme heat. So they've listed the climate hazards as coastal storms that bring flooding and wind, sea level rise that affects tidal flooding, really felt in our coastal neighborhoods, precipitation from inland flooding, and I do want to point out that that means stormwater flooding. You may hear that term a lot. We have a stormwater resiliency plan. We have inside that plan, we have stormwater maps, and it shows you how climate change affects really all our neighborhoods. And the city is working on both communication plans to let people know about it, as well as efforts to lessen its effect on people. Extreme temperatures, heat waves, and cold snaps. So we're focused on heat waves or an extreme heat event. Groundwater table rise, coastal flooding. So again, that's a particular hazard for coastal areas. We can't say it enough. You heard it from Manira, you heard it from Anna, but heat exposure is deadly and preventable, right? Deadly and preventable. And who are the key folks to help us with that? That would be you, to help us notify your community members that you don't have to die from heat exposure. There is help at hand. So cities are up to 22 degrees hotter than their surroundings. New York City heat mortality rates are associated with poverty and poor housing quality. Only not quite 75% of folks in New York City have air conditioning. That leaves over 2 million people that don't have it. On average in the summer in New York, there are 450 heat-related emergency department visits. We heard that from Manira too. 150 heat-related hospital admissions, and 13 heat stroke deaths. So, and again, Manira's department really pays attention to the data, and they compare it over a period of years. So you can really trust that what we're hearing is the truth. It's not made up. It's these things happen in New York City. On the bottom right of the slide is a black and white and a little bit of red graphic showing a cityscape with some trees on either side of it. Heat doesn't impact everyone equally on the slide. There are two images. And I'm sorry I didn't introduce myself. I'm Jill Cornell, and my pronouns are she, her, hers. The image on the left, there's a person with a hat and a blue shirt who's wiping perspiration off of their face. And on the right is a screenshot of the Heat Vulnerability Index, also affectionately known as HVI for New York City. And you can see the hot red coloring that indicates the hot zones there on the right. And that's all. You can find that on that dashboard, and we'll be sure to link that to you so you can see it. Again, the population is most at risk: people who do not have or use air conditioning, over 65, have chronic health conditions, socially isolated, limited mobility, abuse drugs or alcohol. That's also in Manira's slide, or have cognitive problems. They're at risk too. Cool Neighborhoods NYC. That's a program from the Mayor's Office for Climate and Environmental Justice. And we have 6 images on the right outlining the main programs. Tree planting, that's the top left, bunch of people around a tree being planted on a street with a white car in the kind of the mid-ground there. And just want to point out that if you look on our YouTube channel, you'll get the Tree Bernard recording that we did a couple weeks ago. And I'm really happy to see this focus. You know, we know that planting trees is important, but the Cool Neighborhoods NYC really goes into greater detail about why and how they transformed a couple of streetscapes to give more shade. Cool roofs, cooling centers. You heard Anna go into great detail about that. Be a Buddy. Manira talked about that program, but we can also do that as good neighbors and New Yorkers. Training trusted messengers. That's also a program from the Department of Health that is under Manira's shop, and they train home health aides to help get the word out. So important. And I'm sure DIFTA might be figuring in there too. HEAP, and I'm not sure what LI HEAP is, but I will say cooling assistance benefit. That's what we're focused on there for HEAP. So the purpose of the program here is to protect and prepare New Yorkers. We focus on vulnerable populations, underserved communities, enhance quality of life, promote community cohesion, utilizing existing networks and resources. So again, you folks from faith-based organizations and social service organizations and co-ods, et cetera, you are our networks and resources. We recognize that. Thank you. Disseminating climate information. I think for all of us, we're really starting to hear this messaging come in loud and strong, and we're certainly putting it into our messaging, and the city's very focused on it. So we hope that the takeaway that you heard Manira talk about that at the beginning, that we have seen these periods of heat start earlier and later. They're more prolonged, there's more of them. And this is something that for us to pay attention to it and try to lessen its burden on our neighbors is so important. And I'm going to stop sharing my screen right now and see if there are any questions. So it's a myth that it's always cooler on the coast. I believe that Laura is referencing the HVI map. I think it more has to do with the built environment that might be there, as well as it's complicated. And you heard Manira touch on it a little bit, that, you know, in some of our coastal neighborhoods, we're not going to mention any names of any urban planners, but they had made congregate housing or housing developments and didn't put in maybe a lot of green space. And so there are pockets of smaller heat islands. It's not as intense, for example, as maybe as we see in East New York or East Harlem or Brownsville. But there are some of those pockets on that map, like in the Rockaways. That's what I saw. Social environmental factors, that's what Manira is chatting to us about, that they contribute to it. So it's not just your location, it's also those social environmental factors, this the systemic racism that a lot of Black and brown communities experienced with redlining. That's still, we're feeling the repercussions still today. Laura reminds us that the Brooklyn Waterfront Center is having an all-day webinar tomorrow in Jamaica Bay, sea level rise. Again, shameless plug number 4. I did put that in the community preparedness newsletter this week, and I hope to catch some of it because it's one of my favorite conferences that happens during the year. Yes, so Laura acknowledges that the RNG maps, also known, I believe, as the heat vulnerability index maps, indicate vulnerability, not necessarily actual temperatures, but vulnerability is very important to consider while we do this outreach for our neighbors. Michael asks if there's specific information about heat risk and mental illness and psychiatric medications that Michael could share with the National Alliance of Mental Illness. Manira, can you take that question, please?
Yeah, not at this time specifically, but we are working on material. I will say that for the supportive housing community, and we do have another document for general community partners, but for the supportive housing community, that's the mental health supporting housing community, we did create a checklist of what to do before, during, and after to help support residents living in social and supportive housing, and really help organizations prioritize clients and consumers for assistance during extreme heat. I will drop it in the chat.
The questions for today have been really so on message and so focused on the topic. I really cannot thank you enough. And I'm mindful we're now 2 minutes over, and I want to thank all of you, especially our presenters, for coming, our community members and houses of worship. Thank you for coming. It really means a lot to us that you came and are going to be able to spread this information out, and you're sharing your spaces. Laura's dropped the link to register. So if you want to, I'm going to save the chat. I'm not sure if you have that ability, but we will pass on all the links in a resource file because there are a lot of resources in the city to share about this. So we don't want them to get lost in a chat. We want to put them into a one-page document for you. So thank you for joining us. And come for part 2 on the 26th, which is really going to take a much deeper dive into what community members can do to keep everybody safe. Thanks, everyone. Bye-bye.